Well, it's Joy, Savage Joy on Real Progressive. Today I had someone reach out to me, actually last night, who's going through a horrible ordeal as far as healthcare goes that we hear all too often. Her name is Lola, and her husband's name is Charles, and he is in and out of the hospital with medical problems, and basically he's not getting the treatment that he should be and that he deserves. So she's going to share her story, and then we're going to try to get some people to rally to contact his congresswoman because she doesn't care, essentially. So thank you so much, Lola, for joining us and for sharing your story. Do you want to just kind of start with, what, how your husband started getting sick and how all of this started?
Yes. Hello, everybody. My name is Lola. I would like to start at the beginning because that's why this is a story that is perhaps worth our attention. What happened was that my husband had what he thought was a sore on his foot. And I saw it, and my mom saw it, and, a lot of people saw it, and we thought, well, it looks bad, it looks like some kind of a wound. Go to the hospital, check it out. So he went to the Veterans Hospital. He's a Navy veteran. And they just didn't think it was anything. Fast forward a few months, it was a mole, and now it's a cancer that spread all over his body. And right now, we heard the prognosis is very bleak to very, very bleak. They are not giving us any details yet because they are doing some tests still. The reason it's so infuriating, to me at least, is not that much the part that it was undiagnosed or misdiagnosed at the Veterans Hospital. I'm really not the person who can, I don't know anything about quality of care there, how it compares to other hospitals. What is really upsetting to me as a person who grew up in Europe and grew up with universal health care, what is upsetting to me is that my husband was feeling bad, increasingly bad, losing weight. He was worried about his sore on the foot. He still didn't know it was a mole, but was afraid to seek second opinion. This is what this whole story is about. If we had Medicare for all, this would not have been an issue. Like many Americans, my husband, despite being a veteran and being supposedly entitled to health care, he was worrying about the cost. And it's just heartbreaking to me because we have an 8-year-old son. And I just, he loves his father, and I just can't imagine that it is possibly too late for an intervention. So this is the story, more or less.
Wow, that's just so heartbreaking. So does your husband not have any insurance right now?
He actually has Medicare. He always had Medicare. He was just kind of lost in the system. Supposedly his car didn't work. He was sent from one institution to another. You know the story. So many people go through this. That simply he couldn't figure out his insurance situation. Now, when you grow up in a universal healthcare country, I can guarantee you that nobody worries about their insurance card because everybody knows they're insured.
Right.
So even if you don't have a card that's working, you know that this will be fixed. This will be somehow figured out. You go to the doctor. You go to the emergency room. You don't wait till your insurance situation is cleared up.
Yeah, that's wow. I can't even fathom what you're going through. No, we were discussing online his congresswoman in Brooklyn. Her name is Carolyn Maloney, and I want to put this out there before I forget. Her phone number is 718-349-5972. So we're encouraging people to call and tell her about this and explain why Medicare for All is necessary. And basically, she should actually care enough to speak to people when they're in these situations. So when you call there, what kind of things do they respond with?
Well, I did not speak to Congresswoman Maloney. I spoke to a staff person who took down notes, and then another staff person called me back. I don't remember the name. What I was told is that this is not the kind of things that the office does, that they don't get involved in cases like this. She brought up some ethical rules, like it was not ethical for them to get involved. She also, I know she wanted to be helpful, but to me it was like just not something I wanted to hear at all at this moment. She told me to Google public health advocate, and they were going to give me a list of resources. I don't know if any of you ever had to use any public resources of that sort. Well, I had in the past gotten a list of resources, and I remember very well how it ended. Like I sought help in a dispute with a landlord. So there were a lot of addresses and phone numbers that I got. I got zero help after going to each of the addresses and calling each of the numbers. And I'm sure that this is not only my experience, and it's typical that you go to a place and they give you another list and send you back to the place that sent you there, So I didn't even look this up, this public health advocate. I have to be honest. Because right now I'm trying to very quickly kind of get a crash course on how to match a diagnosis to a possible clinical trial. I'm learning about all these cancer centers all over the country, and I have to say a lot of Berners reached out to me in my DMs after my appeal, and I have gotten advice, I have gotten encouragement, I have gotten some contacts. It's just an amazing community, and I want to say 3 cheers for Bernie Sanders supporters because they're the best. They're truly the best.
Yeah, they really are.
And very caring community. But there is a limit to what they can do. And what I believe that my husband needs now, and I might be able to get it. I'm working on it. On some contacts that I got. But I would, I think that this is probably something that I would like the Congresswoman Maloney, for example, to do or to be able to do, because possibly she's really not allowed by law to do that. And let me tell you what I think should happen in my husband's case. Because he was so neglected by the system, and this diagnosis, very devastated advanced diagnosis, is coming, so late. There is so little time to even match him with a trial. I so wish that. Let's talk about the ideal situation, which I don't think could happen, but let's say it's a Hollywood movie, okay? What I think should happen right now is if some super doctors team has, descended on us and took him in, examined him, looked at his test results, and made the best decisions for him right now. Okay, but maybe this is too much of a Hollywood story, but let's talk about something more realistic. If somebody could help him be immediately admitted by a cancer center, there is a certain hurdle to that. The hospital the hospital kept him for tests. I'm hoping that this was really in his best interest, I don't know what their thinking was. They kept him for tests, and they would not make those tests available to me in a form of, a CD-ROM, or what are you calling these things? A disk, right? In such a form that I could share for to get a second opinion. So I was already getting some people through the DMs who wanted to look at it, who were far away physically, and could not help me by coming to the hospital, but who were willing to look at it, and this was not made available. Right now, the hospital discharged him, although yesterday and even this morning they were talking about he has it's either a part of this, it's either a metastasis from the melanoma in the foot, or it's a secondary cancer, they are saying, in his colon. And they were talking about an immediate operation, okay? But they backed off from that. So now I don't know, are they doing it because it makes no sense, it's too late, or he has more time? I have no idea, nobody told me anything. That's why I really believe that even if he doesn't have the biopsy results yet, that he should be at the cancer center, where these kind of decisions, that they were trying to make yesterday, that they be made by an oncology team, where there are people who have experience, and they don't, like yesterday, they were almost ready to do this operation. So I know that in a cancer center, they will know if this is worth taking a risk before their full biopsy results. So I would like to get him quickly into a cancer center. But the way the cancer center works is they want all the results first to be faxed to them before they even make an appointment. You see, another delay of a week or 2 weeks or 3 weeks. Now, the way that these doctors look at the hospital where we were, and I don't want to say what hospital it was, because I don't, maybe they were doing everything they could. It's just that he should have really been, first of all, diagnosed much earlier, and he should have been at the cancer center. That's all. So that's more or less the story. Do you have any questions? I'm sorry, it's not an interview. I just took over.
Oh, no. Like, No, everything you're saying is exactly what I would have asked. What now? I know you're staying in a hotel. Tomorrow, does your husband go back for more treatment?
No, they discharged him today, and they gave him a bunch of appointments for the next week and the week after.
Wow. Now, has anyone from the VA reached out?
I tried talking to one person who called me. This was probably not the best person, to talk to. Let me see, what I was doing about the VA is I haven't really contacted them yet. I have like 2 leads, what to do about the VA. But I'm just not, because of what happened originally, how it kind of, the whole trouble started there, I just don't feel, very, I lost my faith in them, so to speak. But but I probably should contact them, and the reason is, the office of Congressman Maloney said, that they can't get involved and kind of like they can't send a doctor. It made me think that the government actually does have doctors, because the VA doctors are government doctors, aren't they? They are under the VA administration, and the VA administration responds to the committee in Congress, right? So,
absolutely.
So there really should be something that the Congress person can do about speeding up somebody's medical help if that person is a veteran, especially, right? Because there is already a system set up for that. So I used the word rescue my husband in that conversation. I didn't have much chance to talk. Our conversation was very brief. She asked me, "What would you like me to do for your husband?" And I said, rescue him, rescue him for the situation in which he really needs help very fast now, because we don't know if he has days or weeks or months. And these decisions, everyday decisions right now, might mean life or death for him.
The Congresswoman could have, at the very, very, very least, could have called the cancer center and say, "Hi, I'm Congresswoman Maloney. I am just inquiring, how does this process work? What if someone, is in need immediately? How can they do that?" They would bend over backwards to help her, even if she didn't get into names and specifics and stuff. And then you guys could have called and said, "Hi, she called on my behalf, and this is what we're going to do." She could have done something. I understand that certain things are, there's red tape, but that's bureaucratic nonsense that they're not even willing to try and help.
Well, maybe they're really not allowed to do that. But then it makes no sense to me again, and it's all going back to Medicare for all. Right? Because absolutely, that's where it goes back to. We should all be insured. We should all be able to go to the doctor when we need to.
Yeah.
And then there are many fewer emergency situations like this, that something needs to be solved quickly.
Right. Wow. So as far as Medicare for All, what do you think about all the candidates with all of their different proposals? As someone in the situation whose, husband needs Medicare for All, is there one plan that you think is best?
Well, and this is my standard Twitter comment, on this subject. If these other plans that the other Democrats are coming up with, the rival plans to Bernie's plan, right?
Mhm.
Why? I don't think we even need to understand these plans to know that there is something bogus about them. Because why are they coming up with all these plans now, with all these fantastic solutions? If they had those solutions all along, why weren't they discussed before? Why haven't they voted for them? I mean, when you look at the history of American Congress, I speak with an accent, so you know that I'm an immigrant, but I did study, I'm actually a historian, and I did study American history as well. And when you look at American Congress history, there were times that Democrats were in power and they have not done anything about healthcare. They keep saying it's the Republicans' fault, but I don't see it that way. And I encourage everyone to just even look it up on Wikipedia, and you have it beautifully and in red and blue shown when you might want to bring up that graphic for this part of our conversation to show to people that I'm telling the truth, that the Democrats really had, there were times where they were in total control and they could have done it, and they haven't. And they shouldn't just blame it on Republicans. So this is my first this is my first response to when somebody says it, is that this is the great plan, this is the fantastic plan. So why didn't you have it before? But I don't know if you want me to continue. I have more to say about this. If you want me to continue, maybe you'll another kind of common sense thing to me is that private insurance companies really serve absolutely no medical purpose whatsoever. That their only purpose is to make money. So it's just another common sense thing. Eliminating them is not going to affect care in any way. It's as simple as that.
Yeah.
That's the math, That's the math. What do we need for healthcare? For healthcare, we need doctors. We need to educate them, right? So we need medical schools. We need buildings in which we treat the sick. I tell you what I think we need, what I really, really feel like we're missing right now, our family, is that we don't have a place to stay that kind of goes with his illness. We weren't homeless. I don't want to say we were homeless, but we were in some difficult living situation. But we managed. But right now, he's sick, and we would like to be close to the cancer center. The humane, I was dreaming today when I was thinking what I would like, what would the ideal situation be. And it would be that cancer patients can stay with their families close to the hospital, that they are, sort of like almost like dorm apartments or something, I'm not talking about luxury, but the people can stay together with the sick person, which you probably know that right now most of the treatment is outpatient. You get the treatment and then you get sick at home. You get very, very sick after the chemo. And you need to be with your family. So even if my husband got into some fantastic cancer center somewhere, that would mean not only plane tickets for either we would have to send him there alone, right? And then he's missing a very critical element of going through through treatment, which is
Right.
support of your family, you know. So again, I'm dreaming, but I think we do need hospitals, and we need places where people can stay with their families while they're healing, you know. I'm just such a dreamer. I should have been born in 19th century when
That makes so much sense. I never even thought about that. Makes so much sense.
So that's what we need. We don't need insurance companies. They play no role in healing. I like what's her name? The one that everyone makes fun of.
Alexandria?
No. One of the Democratic candidates that everyone makes fun of because she's a little bit,
Marianne Williamson.
Yes. I like her. I like her. I think I like her to be on Bernie's team in White House.
Yeah, a lot of people have been saying that.
Yeah, Ministry of Crystals or healing crystals or something. I mean, she brings very good energy. I mean, I can't compare her to Bernie as far as his vision and his experience, and I don't think she's really a serious presidential candidate. But I like what she brings, and honestly, she's much better than a lot of people there.
Oh yeah, I agree with that. As someone who had, essentially Medicare for all before you came to the United States, do you think that the quality was any lesser than, or took any longer to have things done?
Okay. I can't quite honestly answer that question because I was young. So, there still might be some differences with care when people really got sick, get older, But I had perfect care, and everybody in my family. It was in one of the Western European countries. I don't want to say which one, because I don't want people to know too much about me. But it was one of those really good countries, that Bernie kind of mentions sometimes, And it was wonderful. And we came here for many reasons. I came here with my parents, and my father was invited here by he worked for an American company already. So he was invited to come here, and he really wanted to come here for professional reasons. So
that's
he made
awesome.
He made this decision. I was against it, but I was too young. I was against it. I already knew that I liked it where we were, because perhaps as a woman, I needed that security of what that country offered, and I knew that healthcare was part of it. I just always knew. And I tried to function here. I've been here for many years. I just haven't lost my accent, and I don't think I will ever lose it. I had a choice to take some lessons to get rid of my accent, but I decided not to.
No way! It's awesome. Don't you dare.
But it makes people think that I just stepped off the boat, whereas in reality I've been here for 30 years. And I have a couple of degrees from American universities, but it's hard to believe with my accent, I know. So
well, you're extraordinary. I can't even fathom what you're going through. My heart goes out to you, your husband, your son. What can we do to help you? So we can call Maloney Congresswoman Maloney. Well, what else can we do? Can we follow you on Twitter? Can I give out your Twitter handle?
Yes, please. I will be posting some updates from our struggle.
Okay,
just ask people to follow me, okay? Because I've been getting a lot of response that I haven't even followed up on yet. I kind of got busy because of this semi-public appeal. It's Twitter, so it's mostly my followers, and I have like 2,000 followers. I'm a very small fish in that pool, so it's hard to even call it a public appeal at this point. But it already generated a lot of answers that I haven't quite followed up on. So just ask people to. I don't even know if I want to annoy Maloney, because it looks like she can't do anything. You know what I'm saying?
Yeah.
I don't know if it's a good idea. I have this idea which I don't quite. Honestly, I need help because I can't manage it all. I'm trying to get him into a cancer center right now, and I'm kind of really digging deep into his diagnosis right now. Trying to talking to some people that I met from on Twitter, trying to figure out what how bad it is and what can be done on medically. So I would really appreciate some help if someone would be willing to investigate the veterans, what can be done from that side. If anyone would be kind enough to look up some veterans organizations. We've tried before with other things, again, I mentioned it to you, we had some problems with housing. And I have to tell you, it's very difficult. And we kind of tried using the whatever the government offered. But somebody yesterday brought up on Twitter to me that they are voluntary organizations of veterans. Veteran groups, basically. And somebody could, yes. So they advocate for people. If we got a group behind us, that could maybe help us get into a cancer center. If that becomes a problem, because I mentioned it that I'm already working on getting him into a cancer center, someone is helping me. So maybe it will work, but if it doesn't, then maybe I need to have an organization behind me. So if somebody was willing to do some research on that, I would be very grateful. And I guess another thing that maybe somebody could research if they wanted to help me is these public advocates. Do they really exist? These medical public or medical health advocates that the person from Congresswoman Maloney's office mentioned. And if these people exist, then if somebody could find someone that wants to help us, I'd be very grateful.
Awesome. Absolutely. I will definitely put that in the comments when we put this on the air so people can listen. And there is Veterans for Bernie, and I know that they have literally across the United States Veterans for Bernie. So I will reach out to them because they deal with a lot of things with healthcare.
Yeah.
So
I send them a tweet. I send them a tweet, but I think that if people don't follow you, they don't even. Some people just set the Twitter on, not even seeing the tweets because they get like thousands of tweets So I was so lucky
Yeah.
that, for example, we already followed each other, and that
right.
because somebody told me about you, and I'm like, can you introduce me? Because if I send her a tweet, she won't see it. But you were already following me, for which I'm very grateful, because I'm hoping that maybe our conversation will result in some, in something, in some next step for us.
Absolutely. Well, thank you so much for joining us and for sharing your story, and sending love and positivity to you, your husband, your son. If anyone can do anything to help Lola and her family, you can follow her on Twitter at Lola MOTZ Month. At Lola Month. I just can't thank you enough, and I wish you the best of luck and health. And you are strong. Let's put it that way. You are a warrior. We're gonna do everything we can to help you guys.
Okay. Thank you so very, very much. And
absolutely. Thank you, Lola.
I hope that if we have some major updates, I know that there will be probably a point at which we have a full diagnosis, and then we will try to match him with trials. And then at this point we would really need people who are in medical profession, which some of them already responded to me, but you could put this kind of an appeal on air then at that point. To try to match us with an experimental trial, okay?
Right, absolutely.
Okay.
Thank you so much.
Thank you so much for taking the interest and helping my family. Thank you very much.
Absolutely. Bye. Take care, Lola.
Bye-bye.
Bye-bye.